just a general comment.
Thank you. What I'd like to ask is, Deborah, could you just kick off? We have questions here about why governments are not demanding more, and we have questions around health workforce and the information systems. If you could offer some closing comments, and then Stefano, Mark, and then we'll come to Nandini to close and adjourn.
Thank you, Stephen. I always have an identity crisis when I sit and I'm called a donor, and I come from the grassroots where I had run programs. So that's what I want to bring into as I answer these questions. Nandini, why are countries not requesting resources? I'll give you a very good example, and with your permission, I want to use Uganda. The engagement of the bank with Uganda is a very long one, and we had a program called Sexually Transmitted Infections a little bit before we started the AIDS program. And one of the achievements that the STI program in Uganda did was to train someone in health information systems and data management, and this was a monitoring and evaluation person. A couple of years later, when the STI ended and we came in with an AIDS program, we found this individual, and he was the manager of the program. He was no longer doing monitoring and evaluation. Systematically, from country to country, I have seen it in my own country, people get trained because they had to, either they want this individual or donors dictate it to them, but without the infrastructure for this individual to go back and do exactly what they're trained for. It is a number of reasons. Again, we can spend hours on this. It is also a career development plan of the country where a simple monitoring and evaluation person or somebody who is trained in health information system may not go up the career ladder. So you find these individuals doing management. That's one of the reasons. The second reason is also the weakness of the funding organizations themselves. It's one thing to say it is up to the countries to do A, B, C, and D. It's a totally different thing when the checks and balances are on both sides. If we say 15% of the resources should go to monitoring and evaluation, for example, it is a two-way street. Supervisions happen every year, and it is up to us to say, why is this resource not used for this? So it is a two-way street. It's a long problem which we need to solve. Task shifting, who is addressing the gap. First of all, I don't want to be misunderstood by the audience that the World Bank is doing something which is dramatic and different from the other institutions. What we are doing in partnership with everyone, including the World Health Organization, with a substantial grant from the Norwegian government, is to look into this and to see what is appropriate for specific countries and how do we solve this problem. It is the training system in many of the countries which prohibits task shifting. In Ethiopia, it's unheard of if a nurse dares to do anything which is supposed to be done by a physician, because they are not allowed to know things which in some instances know better than the doctors themselves anyway. So these are entrenched programs which need to be built in, which need to be, which take time, but it is up to the countries to make sure that they reform the system and they dictate to donors to subscribe to this reform in the system. And that is how they are going to fill the gap. What does the World Bank do, which is unique, is to fill this gap and to provide the resources provided the countries are interested and the countries request the bank. So that's as much as I can answer. The point which should irritate and make all of us angry is the divorce between programs, especially on HIV/AIDS, and the research and the intellectual capacity in developing countries. Again, I will use Uganda as an example. The first time I went to Uganda to work on the STI project, I couldn't see the Ugandans that I know because I come from academia. And I kept on saying, where is Professor so-and-so, where is Dr. so-and-so? There wasn't that linkage between program and teaching institutions, and the reverse. In another forum, when I asked my colleagues, do you know about the map in Uganda? They say, what's the map? So this is something which we need to correct at this stage of the epidemic, where we need the product that is coming out from research institutions in the South to inform programs on how we implement programs in the South. This should irritate and anger all of us. Data system generation, I think it alludes to the first answer I gave. Mozambique, I'm really disappointed that whatever we have done is only on paper. This is something which I want to follow up, because we have a huge outfit which is at the call of countries to come and build systems. And if that is not working, we need to be told, because we are wasting everybody's time. Thank you.